Just a little bit about Denmark, 5.7 million citizens, central managed healthcare system. We only have one health insurance in Denmark. Healthcare provided directly by the public sector. We have a unique person ID, lifelong and multi-purpose. So this ID that we have, this number, can be used for healthcare, identification, taxation, insurance. Private companies also use it. So it's used all through. And also with this personal ID, we also have a personal digital signature, which means we can identify us uniquely with this number to different IT systems that we are logging on. We have a lot of things going for us when we want to build electronic e-health systems. The citizen and the healthcare professional can access health information on a national level. We are making interfaces for data exchange in the healthcare sector. We have a multi-vendor strategy. We are doing standards, we are doing interfaces that can actually facilitate the exchange of healthcare data in the Danish healthcare system. We are using messaging, which means one party is sending an electronic message to another. Then we have also some central web services. For instance, we have a national medication record. That means that every citizen in Denmark will have their information around what medication they're on in one place. We only make standardization by demand. We started in '94 and we are now up to 5 million messages going out in the Danish healthcare service a month. Think small, disseminate big. So find a small use case that everyone understands. If you cannot explain your strategies in a plain language, you'll probably never work in real life. Is telemedicine feasible? Clinical, safety, patient-wise, economically? And we had these different areas that we looked upon. Does it pay financially to run telemedicine? The message here is that telemedicine is not a silver bullet. It's not something you can just apply and then you can get good results. If I have a hammer and I want to cut a tomato, that's a bad idea. A hammer is good for nails. And you should be very careful when you get these new tools, because some people think if they have a good hammer, everything is a nail. What we wanted to do was to make an infrastructure that generically could support all different kinds of solutions. Make sure that all these home care and home monitoring systems, that you can share the data across the different professionals, the different systems, the different regions, and to share them nationally. We are now implementing a telemedicine support for COPD patients that will be nationally rolled out by the end of 2019.
Mr. Petersen, which are the positive frame conditions in Denmark concerning e-health?
Yes, you see, in Denmark we have a very long tradition for central registration of the citizens. So we have a national unique ID that follows us all through our lives, and that is used for multiple purposes, both healthcare, taxation. Every contact with the public will be done through this national ID. So it's used both officially for governmental, for local authorities, and also for private companies. So it's very easy to identify citizens in Denmark.
Which projects are especially worth mentioning?
I think one of our main achievements right now, because I'm talking about it because it's rather new, that is all Danes, their medication information, that is what kind of medication are they taking, is in one place. So everyone in Denmark that will concern themselves with handling medication information will always get it from the same source. So everyone is sharing the same data.
Electronic monitoring is already very common in Denmark. What about the data security?
Well, with regard to the data security, we of course follow the EU regulations that applies to all EU countries. And then we have the local legislation, which is put in the Health Act, which regulate who has access to which and under which circumstances. So there is a regulation saying, for instance, you're only allowed to access information if you have a current treatment relation with the patient. And all this is put into legislation and is also put into our systems. So the system also have provision for checking whether there is the right relation between the patient and the healthcare professional.
To which extent are the frame conditions in Denmark better than in Germany?
I think we have a more liberal legislation around what is allowed and what is not allowed. As far as I understand it, in Germany, you have to get the patient's consent, the patient's permission to register and to share information. In Denmark, we have, so to say, the opposite situation, that we are allowed to share and to hand on and to get information without the patient's consent, but the patient can restrict this access. So we have what we call an opt-out, while you in Germany have an opt-in.